Okay, in this video we're going to go over standard machine checkoff and morning setup. So we're going to come in your room, first start off by turning on the machine, turning on your monitor, and let those two fire up. In the meantime, what you can do is you can take a look at your vaporizer, your CO2 absorber. This one looks like it's been a little used here, so we're going to go ahead and change this one out before we do the checkoff so we can make sure that the new one doesn't have any cracks or leaks in it. So to take this one out, you come over on the side, and there's a latch here that you can drop down, and that'll release your old one. Slide it out. Put the new one on by the handle, just at an angle, making sure to line it up. And once it seats, give it a little click into place. During that time, the machine will be turning on. You can see our vaporizer here is a little low, so we're going to go ahead and refill that.
Where's the...
Okay. Unlock it by turning this knob here. Take it off. Each individual vaporizer will have a specific lid for it. Throw on the lid. Tightly so you don't have any leaking while it's going. Line up. And simply just press down. And we can see the level of the vaporizer rising. To relock, cap back on, back into place, so you hear a click, and then turn the lock, so we're not going anywhere. While you've done that, your machine is now on, and we can start with our full checkoff. So the machine will give you a set of instructions if you just select full test. So first thing is we're going to switch the bag vent, switch to vent. So that switch is here between the bag and the vent setting. Flipping back and forth. That puts us on the vent. Opening up the patient Y. So this is the patient Y here. We're just going to go ahead and open it, keep it open while we do our first step. Third step, calibrate to remove the flow sensors. So we go back to where we changed out the CO2 absorber, and there's another latch here that we can take out right
Just
here on the
above
side.
this.
Yep. So to take it out, it comes out all the way, but it's easier to just give it a little pull out. So just about an inch or so to expose this. And then we look back on our screen. And once these two yellow boxes pop up, we can just go ahead and put it back and relatch. And now we're ready to hit start and let the machine do its checkoff. The first step is fairly brief. In the meantime, you can check your suction. Suction on-off switch right next to your power switch. On. And you have a little dial here, so you can test your suction if it's on. If your suction is not on, you can trace it back to the vacuum itself, making sure that all the connections are nice and snug. And that's usually the culprit if it's not working. One of these might have got disconnected, cutting it off, or the connection from the actual vacuum. So just walk it back to the actual collection box. That's why it's not working. In the meantime, the machine is on to the next step. Starting off by making sure the bellows are fully collapsed, and we can see that they are. Occlude the patient Y. We're going to take the patient Y here, and back to where the latch was, right on the side. There's a little knob there to just occlude it, and it fits snugly on there. And you can just hit continue and let the machine run its second step. While that's going on, it gives you some time, about 5 minutes, to come over and start with your setup for your medications. Typical morning setup, you're going to have Versed and fentanyl in 3 cc syringes, followed by lidocaine in a 5 cc syringe, propofol in a 20 cc syringe, rocuronium in a 5 cc syringe, and then Decadron and Zofran both in 3 cc syringes. Rescue medications found in the med drawer, atropine, epi, lidocaine, neo, this is a pre-mix vial, ephedrine, that's going to be mixed to 10 per, and then succinylcholine in a 10 cc, which would be 200 milligrams total. With the medications, you can set up your airway setup here. So an appropriately sized airway, consider one size up or down depending on the patient size. Properly sized tube, this is 7.0 for a female patient tomorrow, with a 10 cc syringe. To check the cuff, we're going to inflate the cuff, see that it's holding a nice seal, and then deflate again. Stylet inserted just barely before the Y or the eye of the tube, and bend slightly to give yourself a nice angle there. Eye tape, and then your blade of choice, it's the Mac 3 blade. Gonna just make sure that the light is working. It is. Back in its cover, so that when you come in to induce the patient, you can have your oral airway, your tube, your eye tape, and your blade all at once that you can transfer over to the pillow and be ready to go. Thinking forward for the case, depending on the variety of case, if you're having a case that's going prone, or a case where you might want to listen to breath sounds, you're going to use the esophageal stethoscope and temp probe. A little bit of lubricant on the top. This is your actual transducer here, the hookup. And then if not, we have a nasal temp probe and an axillary temp probe that comes with just a little adhesive circle there. So in the meantime, while that's all going on, your checkoff is still going on. It'll probably be done while you have everything else done. You can take a look around the room, make sure that you have all the necessary cords. Starting off with just a general pulse ox, which would be the first thing you put on when you come in the room. Blood pressure cuff, cord, which would be the second, followed by the lead set here. Temp probe connection, and then if you're doing a case where you're doing an arterial line, a central line, just make sure that you have an adequate amount of transducers, and that you have the proper attachment to drop all the transducers. All right, a couple of things that you might need for case-dependent situations. Orgasmic tube with a little bit of lubricant again. For laparoscopic cases or cases where the surgeon will like the belly emptied, just have it ready with the lubricant on and in the tubing. For warming purposes, you can have a lower body, upper body, depending on the case. Speak with your staff and speak with your CRNA about what would be the most appropriate. And another heating option is the bear hugger here. This is the bear hugger tubing.
It's Ranger, right?
Yes. I'm sorry, Ranger tubing. Ranger tubing. To insert the tubing. Ranger is pointing towards you. Simply just slide up, slide in. And then you can hook up your fluid, and then this will continue on to the IV. And now you have all your heating and your other random things you could need. And in the meantime, your machine checkoff is done with the next step. So once again, we're going to continue on with occluding the Y. We have that done from the first step. Set the bag vent, switch to bag. So we go back to the initial step. And here we are currently on the vent. We're going to switch over to the bag. Select the APL valve halfway between 30 and 70. This is your APL valve here for closing and opening. So in this case, we're going to go all the way to 30, 70 to close it. And we're going to hit start and let the test run. Now that this step of the checkoff is done, we can see that the valve is closed. The bag is holding air. We know that there's no leak anywhere in the circuit. And we can go back to the full test reminders. Select the bag vent, switch to bag. We're currently on bag from the last step of the procedure. We're going to set the APL valve to minimum. We're going to switch back, open it up, and we can see how the bag lets up, and if we squeeze on it, it's not holding any pressure. Check the pacing suction. We talked about that. We have our emergency drugs, manual resuscitation equipment. So check to make sure that you have an appropriately sized ABU bag, adult versus pediatric. I just have that in the case of an emergency. Check our intubation equipment. We went through that, checking it. Select start case. We can select case, and here it will give a display where we can adjust the age and the ideal weight of our patient before we begin.
All right, so you can go in the back and check your gas cylinder pressure. That's what Drag is doing right now. He opened up the cylinders. We see that we have these pressures of O2, N2O, and air. I'm gonna squeeze back there now, and he'll show us how to open and close them.
So each machine should have its own wrench hanging to open and close it. So we just take the wrench onto your appropriate cylinder and either open it or close it as you need, and that'll give you a reading on the front of the machine. So opening it, once you have them open and the reading has been shown, you can come back and tighten to the right and close your cylinders.